Good morning, everyone. I am Dilnasheen Safdar, a head nurse, manager, pediatric hematology, oncology, and bone marrow transplant at University of Child Health Sciences and Children Hospital, Lahore. Today, I am going to share my experience of climate change in Pakistan and the impact on the care of children with cancer. I want to share overview of climate change in Pakistan, pediatric cancer burden in Pakistan, challenges during disaster, and impact of climate change on pediatric cancer patient. Our healthcare worker always try to boost and try to encourage our pediatric patients who are fighting with the cancer to fight this fatal disease. And they always try to join their hands, their colorful hands with the colorful messages with the healthcare workers, with the nurses, physicians, to fight with this cancer. But unfortunately, sometimes we have unpredictable things, unseen things like natural disaster. So when natural disaster occur, the focus is on survival. For the patient with cancer, this is a great challenge because hospitals, cancer centers, and healthcare infrastructures may become inaccessible. So the rapidly emerging climate change are one of the biggest threat to the sustainability of the life on the earth. The phenomena of global warming is a major cause of environmental degradation. According to a Jamal Watch, Pakistan has been ranked globally in the top 10 countries, which has been ranked, probably most affected by the climate change in the past 20 years, owing to its geographical location. So, heavy rains and combination of riverine, urban, and flash flooding have led to an unprecedented climate-induced disaster in Pakistan since June 2022, causing widespread fatalities, killing livestock, damaging and destroying public and private infrastructure across the country. This includes basic health units and hospitals and cancer centers. You can see this is a map of Pakistan. The red covered area is climatically declared area by the government of Pakistan, and the flood affected area is in pink, which is mostly Khyber Pakhtunkhwa and some area of Balochistan, Sindh, and Punjab. And the black dots are the priority districts where we have to evacuate our patients on emergency basis. So the challenges are the concentration of response measures on an acute conditions, timely evacuation of patient from the affected area, treatment and transportation of the patient to hospital, management of injuries, casualties, and dead bodies, providing food, shelter, clean water, and other requirements for the displaced victim during and immediately after disaster. Medical records and biopsy specimen may be wiped out or some birds underwater or destroyed. Childhood cancer in Pakistan, this slide shows the burden, the new cases. It is estimated that there is 8,000 new cases registered in Pakistan, and there is only 17 healthcare units who are providing pediatric hematology, oncology patients for the treatment. But unfortunately, half of them can reach to these centers. That is, average new cases are 4,650. And the Children's Hospital Lahore, University of Child Health Sciences are the topmost hospital in the Pakistan where the average number of new cases are 1,500. So there is average new cases 4,650 and diagnosed new cases around about 8,000. And when we are talking about monthly average new cases at Children's Hospital is about 125 to 150 patients registered in OPD. And in National Institute of Blood Diseases and Bone Marrow Transplant, 40 to 50 patients in registered new cases. But during disaster, June 22, we observed that the number of new registered cases are 70. And follow-up also, there is a decrease in the number of follow-up, that is half of 125 follow-up. same as with the National Institute of Blood Diseases and Bone Marrow Transplant. So this is the first impact, that the patients who are trying to reach the healthcare facility are unable to reach. The first and most important thing is transportation. You can see this is a recent picture of the disaster. This young guy tried to evacuating their children from the affected area to the safe place, and for shelter, for food, and for clean water. And the mode of transportation, that is mainly here in Pakistan, roads and the bridges, because we have rivers and some canals. So we use the bridges. You can see this is also a real picture of recent disaster. There are no mean of transportation from the affected area to the safe place. So the patients are unable to reach healthcare facility due to mass destruction of roads. Same as with the healthcare workers, they are also unable to reach. And acute trauma-related injuries are the leading cause of morbidity and mortality in the immediate aftermath of the disaster. And there's insufficient food and the insufficient of nutrition, poor hygiene, and lack of sanitation. Discontinuation of communication system and the power supply network, so patients are unable to communicate with the hospital. We are observing this especially in the Sindh, where the public health infrastructure is damaged and access to treatment and care is severely jeopardized. And there is an increased risk of disease exacerbation or even the death. This family also tried to evacuating from the affected area by their own. And this is very depressing when we came across with this situation. There's bad hygienic condition, lack of food and clean water, and there's no shelter. And our patients who are immunocompromised, they are very much suffered, and we have a lot of challenge to deal with these patients and to handle the patient and provide them the safe condition and good hygienic condition. Our forces helped us for the evacuation of the patients and the healthy people from the affected area. So these are some impacts that I came across, that our patient, as I already discussed, are immunocompromised, thrombocytopenic, they get infected and injured. They get skin infections, respiratory tract infections, malaria, and dengue. Gastroenteritis, which leads to dehydration and electrolytes imbalance, and patient land in our hospital in very bad condition, and we have to manage them and correct all the things we try our level best. And they get severely injured, which cause bleeding and leading to death due to thrombocytopenia, because there is no facility of transfusions in these area. There is no emergency healthcare facility available for the patient, and there is no trained healthcare workers at there. So, and the most important thing is there's a delay in the treatment, because patient cannot access to healthcare facility where we have oncology setting. Most of our patients are on maintenance therapy. They are unable to reach hospital. So they could not get the treatment. Treatment cycle was missed because parents focus on the healthy children and looking for safe shelter and food. Business destroyed. They don't have enough money to go further. Medical records of patient destroyed, because in Pakistan, patient have record on paper. We don't have electronic record in most of our hospitals. There is no availability of drugs and supportive care in affected area. So we should focus on preventive strategies, so we can save our pediatric patients who are fighting with the cancer. So I could say that natural disasters do not discriminate. It is impossible to predict where and when the next disaster will take place. And it is estimated that in 2015 and 2030, that the population in Asia extreme risk area will grow by 35 to 50% in various cities. The National Disaster Program Department, which of Pakistan, should link with the oncology centers, and these should include mapping of people at risk, maintaining a backup of medical record, early evacuation of high risk people, devising mechanism for referral and transfer to specialized care if necessary, preparing emergency treatment kits, and maximizing sanitation and access to clean water and safe food. There should be storage of backup of medication and equipment in secure location, availability of power for medical equipment in evacuation center, and hubs that are set up for oncology treatment and care. We should focus on these things so we can save our children, and we should have strategies, and we should focus on these all these preventive measures. Thank you very much for listening and giving me opportunity to present my point of view. Thank you.